apologize because of some lot of commitments in the office. Couldn't come back for a couple of days. So I wanted to share three important observations which we have learned today. Namely, first is a doctor's testimonial for iCoro, which is a neuromuscular device which works on the root cause of hiatus hernia, heartburn, reflux, dysphagia, the swallowing disorders, and snoring as well as sleep apnea. So we have that review. I'll definitely be talking more about it. Second is about a wheelchair. That three things about manual wheelchairs, and third is about TED stalking. Now TED stalking. So let's go reversed. Let's talk about TED stalking. Now, TED stalking are being prescribed by your clinician in order to improve blood circulation from legs to heart. So, TED stalking, which we work, which we sell, is from Covident, that is Cardinal, and it is white in color. Because of white in color, it is very easy to identify if there is any infection kind of in the legs. Apart from that, it's made of nylon and spandex material, so that allows moisture control better and maintains airflow in light colors. And more important, white fabric reflects heat, so it keeps the legs cooler. Important for patients who are confined to bed. So that's about TED stalking. Is it tight? That was the question. So the answer to it, that if compression are what do you mean by compression? That they are compressing the muscles, and it helps in venous refill. Uh, it's very simple that in the veins blood is filled and then again it's empty, and then in this way venous refill takes place, and more amount of blood is filled, and venous veins take it the to the heart, right? So that is offered by TED stocking, and it gives you a graduated compression. Like the part which is away from heart, there the compression will be more, compared to the part which is near to the heart, compression would be less. So that gives a graduate compressed stocking. So once you wear it, you will find out that this is why it is different than other stockings. Other stockings also provide, but every brand has its own merits. Uh, so, so this is about TED stocking. For the right compression, we have to wear it, and it is going to be tight, but it is made in such a way that it gives you the compression. If they are loose, then it will not give you the compression. That's the first thing we had learned. Second is about the wheelchairs. Now the question was whether wheelchairs are allowed in the flight. So obviously wheelchairs which are manual are allowed in the flight. So whenever you are flying, you have to check with the airlines that it's just that for asking them that can you carry a manual wheelchair. So it's just not to miss any chance. By chance, you should always approach. But as per our knowledge, manual wheelchair are allowed in the flight, and these are foldable. It can easily be put inside the car. That was the second learning. And third is about the a review from a doctor from Bangalore about iCoro. So for that, definitely I will like to go through it directly, because what she has said, it's quite explained in detail. So I will definitely take use of the notes. Okay, if you want to read, you can definitely go uh, on our Google page, which is White Shield Enterprises, and there you will find this review. So, just to read exactly what Matt Doctor has read, Doctor has given, Dr. Anisha, is that iCoro is a small neuromuscular training device which is designed to strengthen the muscles from your mouth to your stomach. By doing so, It can help reduce acid reflux, hiatal hernia symptoms, swallowing difficulties, and even snoring in some case. The idea is very simple, uh, that just 90 seconds of exercise 3 times a day over weeks to months, many patients noticed less heartburn, fewer throat symptoms, and less reliance on medicine. Talking further, some pros that it is non-invasive, no surgery or any long-term drug. It's backed by clinical data studies, and it has NHS recognition also. Easy routine, quick to do. Um, it needs daily, some cons are it needs daily commitment for best results. Not everyone will respond, some will feel worse at time, but that's fine. It happens. So what kind of symptoms you are getting, you can talk to us, we'll try to solve it. So she recommends, as a doctor, she recommends Icoro for patients with mild reflux, small hiatal hernia, or swallowing problems who want a safe, non-invasive alternative to long-term medication. So this is about the point number three, that is Icoro. So we had covered three important points. One is about text talking, why they're tight and why they're white in color. Third, second point is wheelchairs, that is manual one. Are this allowed in the flights that we have covered? And third is where exactly Icoro is positioned. What kind of patients, what kind of people can start using it? So this is all from my side. If you have any questions, I'll wait for 2 minutes, or we will meet you again soon. Okay, I'll try to share this review if possible. If I can share it directly, can I add start a poll? Let's start a poll. Maybe if you have any one who someone who had mild reflux and or hiatus hernia, it's hiatus hernia, sorry, then you can vote yes or you can vote no. Can I start the poll? Can I start? I am just trying to share the information where. Can I share it? No, I cannot. Can I share the information or a Q&A? Okay. I'm just trying to share the link of this review that we have received from a doctor of about iCoro to you guys. If I can share it directly. Who is something? I don't know. Yeah, those who are watching, those who are live right now, they can ask the questions about home-based healthcare. So that's what the purpose is. It's not only about what I share my experiences, but please feel free if you have any questions. We'll at least try to address it and try to give us the. We'll try to give you the information if we have, or we'll speak to our experts and come back. I'm sorry, I'm just having running nose, so difficulty. Yes. So I think those who have joined, they don't have anyone in the known who has mild reflux or hiatus hernia. Good. I'm just trying to. Oh, I'll see if I can share the link of this through my laptop. Can I see that I'm online? When can I see I'm online? No, I cannot. Yeah, all right. I can see that I'm online. So let me. No, I cannot. Yeah, all right. I can see that I'm online. So let me. No, I cannot. Yeah, all right. I can see that I'm online. So let me. No, I cannot. Yeah, all right. I can see that I'm online. So let me. No, I cannot. Yeah, all right. I can see that I'm online. So let me add this. Okay. Okay. So that's a link to my company's page where you can find out my company's page where you can find out the link. Yeah. So there you'll find out more about uh, the the product iCoro. Yeah. Thank you. Thanks for liking the live program. Thank you so much for that. May I know who's this? I can at least come to know because I don't want to have this monologue. It should be more of a dialogue. That's what I believe. Anyway, so think I'm done for right now. If I learn something new and worth sharing, I'll come back again. Thank you very much. Bye bye. See you guys.